great talk. I very much agree with Andy that payment reform is very important. I'm going to talk about something else that the governor could do. There are many other solutions for healthcare that I'd be happy to discuss, but they cannot be done at the state level. They involve federal legislation. But the solution that I would like to see in the state is more transparency, by which I mean more information about how good is your doctor, how good is your hospital, how good are they in dealing with people like you for the problems you have, how much do they charge? Transparency is very important to me, and the governor, who is a relentless questioner, kept saying, well, how did we meet, how did we meet? And I said, Mike, I don't want to tell you because you're going to kill my story. So how did Mike Dukakis and I meet? So I was a young woman, and I was a young woman once, and I was appointed to the faculty of the Harvard Business School as an assistant professor. Harvard Business School is a teaching school, takes its teaching very, very seriously. So I was the second woman appointed to the faculty of the school. This was in the early 70s, where women were breaking through in many different ways. And I accepted the appointment, and the dean told me I would be a regular faculty member, but I couldn't teach. What do you mean I can't teach? It's a teaching school. What kind of career am I going to have here if I can't teach? And he said, oh, you're such a great researcher. Will overlook the fact that you can't teach. And I thought, right. So the reason I could not teach is that women could not succeed in teaching business. And the data point was a sample of one, who was my predecessor, a very fantastic woman who had two negative qualities. One is she was Cuban. That's a fabulous country, but she had a really thick Cuban accent. The second is she was an economist, which in a Harvard Business School is tantamount to a suicide. So she was teaching international economics. What the hell that is, I don't know. And the students were like, what is she talking about? The conclusion was women can't teach. So I said, this is ridiculous. I'm not staying here. And I had a research commitment for about 3 months, and I got a call from then Governor Sargent. And Sargent, who was what, 2 governors before you? One governor. So Sargent said, would you be Assistant Secretary of Health and Human Services? And I thought that was fabulous. I was telling somebody who was doing my hair I was going to be assistant secretary, and he said, great, you're going to be a secretary. I was very full of myself. So I became the assistant secretary, and running around was this young, attractive rep, and everybody said, well, he's a comer. So that rep was not in a position to fire anybody. It's lucky, it's me. And of course the rep was Mike Dukakis, who was very interested. Even then, the rate setting commission was there, very interested in healthcare. So what does this have to do with transparency? So the dean calls me up and he says, we've changed our mind. You can teach, you know, this, I'm sure it was after some lawyerly conversations. Not that I was going to threaten them or anything, but he changed his mind. So I start teaching, and we have big classrooms. They're about this size. We have 100 students in a class, and I come into the class, And I have two men following because they thought all hell would break loose in the classroom. And I somehow did survive, and I got the best teaching award. I got the highest student scores. And I don't think I would have gone back there if it weren't for that transparency, because I felt that my peers, who were very nice people, and some of you may remember that period of time, it wasn't that they were mean or venal, they just couldn't look at me and see a normal human being. You know, I was a woman. But my students, they didn't give a damn. I was teaching accounting, the world's worst subject. And if I could succeed in making it clear to them, it was great for them. So I thought this transparency, the evaluation of faculty, was really my chance to succeed or not to succeed in the school. And it lifted me out of a very narrow, peer-controlled process where I knew I wasn't a peer and it would never work for me, and elevated the perspective of what it is that I could do. So with this long story, you know I'm a real fan of transparency, and I think it can transform healthcare to deal with the kinds of cost issues that Andrew talked about so eloquently. We need insurance reform, we need payment reform, but we also need transparency. And I don't mean anything abstract by that. I mean something just as clear as what I was saying. How good is my doctor in dealing with somebody like me? So I'll tell you another little story about transparency. Part of the cost, I was the first woman tenured at the Harvard Business School, and part of the price I paid was that I always wandered around in 3-inch heels. And the reason for that is I thought, well, I've got to be able to look these men in the eyes. So 3-inch heels were always on my feet. Well, 40 years later, I developed very serious foot problems. And I went to a great hospital in the area where I was introduced to Dr. Foot. This is the foot orthopedic surgeon who specializes in feet. Dr. Foot had a hand about as big as my foot, and it's a good sign an orthopedic surgeon needs rocks like this. Because they're always manipulating bones, and he took my foot in his hand and he immediately could recreate the pain, which shows his deep anatomical understanding of what was causing the pain in my foot. But I'm an economist and I like to look at data. And I have a friend in an insurance company called United, who heads a division of United that's called Ingenix. Where they get these names, same people who named it ACQ, Ingenix, you know. So Ingenix does data mining. Data mining means they know who the best doctor is. So I called them up and I said, look, I have only 2 feet. I'm worried about my foot. Can you give me data about the physicians who have done this kind of surgery, I'm not interested in general foot surgery, this kind of surgery on women my age. You do this kind of surgery on, you back here, somebody in his 30s, that's not relevant to me. Dr. Foot had done 0 on women my age. I found Dr. Toe. I needed toe surgery. And Dr. Toe was in Rhode Island. Now, nobody would think you would go to Rhode Island, but of course you would go to Rhode Island because Dr. Toe does about 30 of these surgeries a week. He edits a journal called Toes. You know, I'm serious. You know, you wouldn't laugh if you were a toe surgeon. He was tremendously expert. And I thought, isn't it terrible that I happen to know that Dr. Foot is not the right guy for me and Dr. Toe is the right guy for me only because I have access to special data. That is insane. Why shouldn't everybody know exactly what I knew about Dr. Foot and Dr. Toe? So that's what I mean about transparency. So if I had gone to Dr. Foot, I would be the first woman in her middle 30s that he operated on for this particular toe condition. I'm kidding, I'd be the only first woman in her late 60s that he'd be operating on. And you know what? Didn't want to do that. So what do we know about transparency in healthcare? We know with Medicare HMOs, when data about their quality and their costs became widely available, better HMOs, better value for the money, gained market share. That's what you'd expect from transparency, that the market moves to those institutions that give you better value for the money. Insurers have long wanted what are called narrow networks, which is one of these imponderable phrases. What the hell are they talking about? So narrow networks means that you can only go to a very small panel of providers, of doctors and hospitals. Why do the insurers like it? Because they're picking very good value for the money doctors and hospitals, and these narrow networks are typically much less expensive than everything for everybody networks. People don't trust insurers. Now, if they met Andrew Dreyfus, they would change their mind. But the insurance industry on the whole is interested, is really grateful that the Postal Service exists because it's like Alabama's happy that Mississippi exists, because it's the only worse-rated industry. So people don't trust the insurers, and when the insurers say, look, go to this narrow network, and I'm going to charge you less, and it's great value for the money, people think it's cheap, that's why you want me to go there. It's not because it's great value for the money. But if you had real transparency about how good are the doctors, how good are the hospitals, you would have much more confidence in picking a narrow network. And the Congressional Budget Office, when we were starting to debate healthcare reform, thought we could save $37 billion if people picked narrow networks. I think if we had real transparency, we would save 10 times that amount, because people would have confidence in saying, yeah, it's low cost. Honda's low cost doesn't mean it's a bad car. It just means that it's a very efficiently produced car. Another thing that happens when there's transparency is, even if the consumer is thick as a brick and can't understand the data, which can happen if the data are presented in an obscure way, just the sheer publication of information motivates people to change their behavior. And this is called the Audit Effect. When companies know that auditors are coming in, they buff themselves up and they start to look much better. So when providers, meaning doctors and hospitals, know that they're going to be audited, that their quality and price is going to be measured, they change their behavior, and just from peer profiling, meaning Dr. A, Dr. B, Dr. C, and by the way, my daughter is a physician. I'm not one of these people who doesn't like physicians, quite the contrary. And so when you have this peer profiling, they estimate just from that, just from the providers, forget about the consumer effects, just from the providers being measured, they would reduce their costs because nobody wants to be on the bottom of that list, or improve their quality so they got much better value for the money kinds of ratings. So we don't have transparency, and I'm going to talk about that in a second. We have, I know more about this bottle of water than I knew about Dr. Foote. To me, that is scandalous. In New York State, there was transparency. It was actually New York, the Commissioner of Public Health was rating how well surgeons did on cabbages. Cabbages are open heart surgeries. He wanted to keep the data private, but Newsday out in Long Island sued him under the Freedom of Information Act, and the data were made private. Who do you think the best cardiac surgeon was in New York City? Unquestionably. I should have put the chart in here. You know this man. It was Dr. Oz. Overwhelmingly was. What a shame. Well, I shouldn't say that. So, Dr. Oz, I'm sure, is doing good in what he's doing right now, but he was off the scale as a cardiac surgeon. So what happens when this kind of information comes to consumers? Well, two things happen. One is consumers go someplace else. Nobody wants to go to the person. This was by a physician who's on the bottom of the list. And the second thing that happened is the physicians changed their behavior. So I've read medical articles which are stunning and admirable in their honesty, where some practice says, we didn't know how bad we were until we saw these data, and we changed our intake procedures, we changed the way we did business. And these findings also held true for similar transparency in Western Pennsylvania. Tony Blair was under enormous pressure because the British healthcare system had enormous waiting lists. Huge waiting list. You would wait over a year for a hip transplant, and if you waited over a year, you not only were in great pain, but the hip deteriorated over this period of time. So when you finally went to get the transplant, it was much hip replacement. It was much more serious than if you had gotten it expeditiously. So Tony Blair put in a series of reforms of the NHS, and he increased the capacity. I'll be glad to talk with you about how he did this, but he also introduced transparency. So for the first time, people who lived in a certain area were given freedom of choice of which hospitals they could go to. And they were given information about how good those hospitals were. Death rate, infection rate, clot rates, readmission rates. This is stuff you want to know when you go into a hospital. So what happened? The quality, people shifted market share. They went to better hospitals, and when they went to the better hospitals, the guys on the bottom of the list had a lot of motivation to change their behavior. So quality and productivity went up and waiting time went down. One of the data that they were given was waiting time in different kinds of hospitals. This, I know there are some students in here, this fabulous paper by Martin Gaynor that just came out in the NDR, if you want to read more about this. Price transparency. You're uninsured and there's no price transparency. You pay 75% more than Medicare. So you know, hospital prices are complete fiction. Who pays those prices? That's the uninsured pay those prices. So since we don't have price transparency, we have this perverse result that the people who are the most vulnerable, most of the uninsured are poor, not all of them, but the vast majority are poor. They pay more because we don't have price transparency. So everybody loves transparency except if it's about them. So when we instituted teacher evaluations in the Harvard Business School, we have, 10,000 applicants, and we comb the earth for our applicants. We admit 1,000 people. They're marvelous. But are they smart enough to evaluate their faculty? Of course not. So there was a huge debate about whether we would do it. Of course, it was in a period of time of student, much delayed and well-deserved student empowerment. So we finally got evaluation of faculty. Does the medical community want transparency? They wanted about Andrew, for sure. But what about them? Oh, please. There is no way you can measure the outcomes of medicine. So what are the arguments that are used against transparency? One is, if you had transparency of prices, that the existing organizations would collude, and the ones who got paid less would raise their prices. Right? So does that make sense? So let's say you and I started a store. What's your name, ma'am?
Grace.
Grace. Let's say Gracie and I started a store and we had very high prices, right? So what's your name, ma'am?
Kate.
Kate would say, these two are idiots. I'm going to come in and cut the price, not raise the price. So what is it that enables collusion in healthcare? It is only because there are barriers to entry. And Kate could not easily enter the business, particularly if she were in the hospital business, because to start a hospital takes, like our teaching the hospitals, tens of billions of dollars. It's an enormously expensive undertaking. So can we have collusion in healthcare? Yes, we can, because we have an oligopolistic market structure, meaning there are very few hospitals and they can collude with each other. If we had more competition in this market, collusion would be impossible, because people would come in and say, I can underprice them and I'm better than they are and I'm going to succeed. Second thing that's raised against transparency is to say, look, if you measure the average patient and how well a physician or a hospital does with the average, you're skewing the data. Because some places, for example, Tufts Medical Center here, if you have congestive heart failure, Tufts Medical Center deals with the sickest people who have congestive heart failure. So if you compare Tufts Medical Center with a community hospital, which does a very fine job, but it isn't dealing with the sickest people, Tufts is going to do terribly, because it's got congestive heart failure, is a terrible disease. It's got very sick people. So they call this problem risk adjustment. This is a very real problem, that the data have to be risk adjusted, that you have to measure how the providers do with very sick people differently from how they do with people who have less severe forms of the disease. Is risk adjustment as difficult as finding a town neutrino, whatever the hell that is? So, no, it's the people who write these equations. This is as difficult as the job that these people do. No, it is a tractable administrative issue. It is a real problem, but it's a solvable problem, especially if we say we're going to solve it. So overall, the Congressional Research Service researched this question: are the dangers of collusion and the problems in measuring how sick the patient is accurately so severe that we shouldn't have any transparency at all? And they concluded no. So why do we lack transparency? One is a failure of government. So So I agree with Andrew. There are areas where government is very important. I believe in transparency that government plays a key role, and it has been missing in action when it comes to transparency in healthcare. So there's a website in CMS, it's called Hospital Compare. And I went to MIT. I'm used to really lobotomizing data searches. I then went to the Harvard Business School. I teach accounting. I went on the Hospital Compare website. Honest to God, took me 3 hours to download the data I wanted. So please, that's not a useful transparency. Agent only lists 6 conditions out of the 70,000 plus you can have. A lot of the transparency data is about process. Did they give you an aspirin? Did they tell you not to smoke? Did they do this? Did they give you an antibiotic? Those are very important data. But what do I want to know? I want to know what happens to women like me when they have toe surgery with this particular doctor in this particular hospital. Can they once again torture their feet and wear 3-inch heels? That's the kind of stuff I want to know. I'm not interested in whether they gave me an aspirin or not. In other words, I want to know outcomes, not process. I don't want to know how they did with that. That's okay, that's relevant. But really, I want to know how good are they. So many are limited to process data. The argument is you can't measure outcomes because you can't measure severity, adjustment, but really, why do they want to measure process data? I would be evaluated by my students on whether I write neatly, or do I fill up the boards with their marvelous comments. Really, my students should be evaluating me on how much I teach them, how good I am as a teacher. Clearly, the way to avoid that sometimes devastating information is to focus on process data. Frequently, they don't have consumer peer data, but people clearly value what their peers think. That's why J.D. Power is so successful, and that's why Zagat's is so successful. Shouldn't be the totality of the information you get, but it should be an important component of the information you get. Do providers, meaning hospitals, doctors, are they good agents of transparency? Surely you jest. So a review of 25 nonprofit systems and the transparency they had concluded none had reliable, relevant, and transparent information. So there are lots of measures you can have. You can measure structure, how are they organized, you can measure how they do their work, the process, you can measure outcomes, you can measure consumer satisfaction, you can measure price. So process measures often do not correlate with outcomes. And they also suppress innovation. If you have a process, you measure just that process, and somebody comes along and says, you know, I have a different process, and it's going to yield better results, but if you're just measuring how the process is, you'll never get, it'd be very difficult to get innovation. Outcome measures, or which is what I would like to see, they're difficult to measure, but they do encourage innovation. If you measure not whether people are following somebody else's formula for how to do things, but whether they're good at what they do, you're going to get a lot of innovation. Innovation, to me, is the key to solving healthcare cost and quality problems. So here's yogurt. This is the yogurt I had for lunch, a screenshot of the slate fermented yogurt from Trader Joe's, and here's the Yoplait yogurt. Look at all the information about this trivial purchase. How much fat, like I really want to know. How many calories from fat. I'm very interested in calcium at my age. I have very precise data. In fact, everything I want to know about my yogurt is there. So here's data about heart failure. It's a little more serious than yogurt. Okay? So here's what I get from both our state website and from our federal website. So you want to tell me what you think of this information? Any comments about, listen, I've got 5 more minutes, so please speed it up. Any comments about this information here?
It provokes questions.
Huh? Doesn't tell you it. First of all, it is suspiciously positive. Call me cynical, but it's over on the right-hand side. Anything else not available, I like that too. You know, yogurt, nothing is not available. Heart failure, not available. Okay, so anything else that, and I have nothing against these august institutions. Anything else about these data that bother you?
There's no context.
Doesn't tell you how much.
How much there? So with the yogurt, I know that it's got 15 calories from fat, like I want to know, but I've got 15% from fat. I know the percent of calcium it has. I have no idea how they rated this. I have no real data. I like my yogurt label a lot more than I like this label. This is what we get from present governmental transparency. I think it's scandalous. So there is a government agency, however, that's been great in transparency, and that is the Securities and Exchange Commission. Securities and Exchange Commission has been a disgusting, dismal failure when it comes to regulation. But it's got 2 jobs. One is to regulate the securities markets, where it's been just inexcusably bad, and the second is to promulgate transparency in the financial markets. Now, how do I know that the SEC has been good at this? Because I read all these boring studies that I have footnoted here. And what these studies did is they compared countries that had capital markets. Capital markets means markets for money. People are looking for money. That's what the stock market is, the bond market is. And which had an SEC model for financial transparency, and countries that had capital markets and didn't have an SEC for financial transparency. And what they found is with the SEC, not that it's perfect, but it's the best in the world. And it reduced the costs of capital because people had confidence in the underlying data. So they didn't want as much of a risk premium because they were unsure about what they were investing in, and it led to better resource allocation. So how do we get an SEC? So we're in the midst of a Great Depression. Not now, 1930s, Franklin Delano Roosevelt is elected President of the United States. Franklin Delano Roosevelt is a patrician, never worked never had to work to earn money. The source of his money was his mother, Sarah, who lived with Franklin and Eleanor. And you wonder why this wasn't a happy marriage. So Franklin Roosevelt is elected President of the United States in the midst of this devastating financial depression. He has no economics background whatsoever. And people around him are saying to him, businesses are corrupt and venal, which they may well be. But the solution was you have to nationalize businesses, which at that time was a very acceptable and may nowadays be, but not as much as it was in the 1930s. FDR, of course, was an incredible genius, politically as well as in terms of policy. And he rejected this advice, and he created the SEC. And he called the SEC the Truth Agency. We would now call it transparency. This brilliant man had the vision in a period where transparency in the financial markets was as bad as it is in healthcare right now, to see that if there were financial transparency, many of the problems that caused the depression, which is fundamentally that when you bought a stock, you had no idea what the hell you were buying. You know, I read testimony from George Westinghouse. Some of you may remember the company Westinghouse, who said, you don't need information. He considered it insulting to be asked to actually have his performance measured. I'm George Westinghouse, you trust me. So he created the SEC, and it's been terrific. So what is it about the SEC that I like, that I would like to see in Massachusetts? It's an independent agency, which means if it screws up, you know it screws up. If some part of Health and Human Services screws up, you haven't got a clue that it's screwing up, because it considers $100 billion a rounding error. So, you know, how can you tell what the heck is happening in that agency? You know what's happening in the SEC. It's aimed at consumer protection. It has a very clear mandate to be a consumer protection agency. Here's some data, the kind of data you can find on the SEC. If you have trouble sleeping at night, I urge you to take a look at this. This is a system called Edgar. So I use Edgar a lot. In about 3 minutes, I can find virtually anything about a publicly traded corporation. So it's not that it's easy to use, but everything anybody would want to know is available through Edgar. And the data are very reliable. They're measured according to GAAP, generally accepted accounting principles, and they're audited data. So where do we get GAAP from? Where do we get these measuring standards? We get it from an organization with a fetching title of FASB. FASB is the Financial Accounting Standards Board. This little organization sets the standards by which corporations are measured. So if we had that in healthcare, we'd have a little group that would say, here's how we measure the performance of physicians, the performance of dialysis centers, the performance of nursing homes. So what does the FASB measure? It measures outcomes. It doesn't measure how businesses do what they do. It measures what they do. It measures their outcomes. It has a budget of $24 million. It's a tiny organization. It is a private nonprofit, and it's collapsed 2 times in its history because the accountants who dominated couldn't reach consensus on how to measure something. I like this organizational structure. I like the fact that it's not immortal, that if they screw up and they can't reach consensus, the organization falters, and they have to start all over again. The people who are in the FASB are accountants, not exactly your laugh-a-minute crowd, but these people are passionately interested in measurement. They're not interested in protecting hospitals, they're not interested in protecting doctors, they're not interested in protecting any stakeholders. They're interested in how to measure things accurately, and they come to blows over these issues. I think that's the right group of people to do it. So what we need, my advice to the governor, whoever he or she may be, I'd love to say that seriously sometime soon, Massachusetts, is you want a healthcare SEC that requires transparency. The SEC has ferocious penalties if you screw up. civil and criminal penalties. It's an iron fist. And inside that iron fist, you want a velvet glove, which is this group, this nonprofit group of measurement professionals who decides what gets measured and how it gets measured. Cheer it up. Thank you.